Now look at two more tests, and these tests are actually done for, I think this is lower limb strength, right? Yeah, it's lower limb strength. So I'm looking at the pivot shift test. We're also looking at the anterior drawer test. So the two of them, we'll look at them and look at how they are done. Of course, these other ones we have looked at them. The McMurray test and the Latchman test, we have looked at them. Okay. So for all of them, they're actually clinical maneuvers and they are done in the lower limb just to make sure that what the anterior cruciate ligament is still intact there, you know. So what's a pivot test? This is a pivot shift test. So it dictates what? Rotatory instability of the knee caused by anterior cruciate ligament deficiency. So how is it done? The patient lies supine. The examiner flexes the hip to about 45 degrees. Keep the knee extended. So the tibia is internally what? Rotated, while the valgus, that's inward stress, is applied. So as the knee is flexed, the lateral tibial plate to subluxates and then reduces around 30 to 40 degrees of flexion if the ACL is torn. So a visible or palpable shift or clunk as the tibia reduces is a positive sign, you know. So it's considered there, you know, when there's actually what? A tear in the, you know, anterior cruciate ligament. Pivot, see, pivot shift. Okay, you can take it this high, you know. So anterior drawer test now, can you see? It's more of like they're actually trying to pull your leg to the front. Okay, anterior, I'm drawing your leg to the front, you know. So you're trying to access anterior translation of the tibia relative to the femur. So the patient lies face up with the knee flexed to 90 degrees and the foot stabilized. So examiner grabs the upper tibia and pulls it forward. So if it is positive, there's excessive forward movement of the tibia compared to the opposite knee. So it's easier to perform but less sensitive than the Latchman test, and the hamstring tension can sometimes mask the instabilities too.